From high demand at A&E to GP appointments, valued community hospitals and outpatient care, NHS Borders is asking the people here what is important to them, which will be used to shape the future of the health board.
I observed three things in the first 3 months I had here. I spent lots of time out in community with our services, also trying to understand exactly how we deliver care here. And there were three key things that came out of that. One was the closeness between our staff and our communities. The second was how effective our teams work together across NHS Borders. And the third is really that we need a local direction about how do we really work more closely with our communities and make it and reconnect with our communities.
Are you expecting any key topics to come out of this?
I think the shift between acute and community care will be one of the interesting things that comes out of it. But I think the most important bit is to really start to look at how the NHS in the Borders moves from treating people when they're unwell to how do we support living really effective, healthy and enjoyable lives.
Is finance a massive part of that?
There's always financial challenges within any public sector organisation. That's really clear, I suppose, across all of the UK at the moment. But I think what we need to understand is how do we use the money that we get at the moment in a more effective way.
The Chief Executive knows that in order to streamline the patient's arrival, diagnosis, treatment and discharge, there can't be any delays at any stage. But that's easier said than done.
I think healthcare it's a team effort. I think clearly there are delays or people do wait too long for care in both in primary care, in secondary care, throughout community care, and we've got to work out with our communities how we best make sure that we come up with some joint solutions for these, and that's really part of how we're going to go out and have those discussions in really innovative ways with the members of our community.
The results from the engagement sessions will help drive strategy for years to come.
So I've been here for 4 months. Part of the real answer, I suppose, that is this needs to be a proper 5-year plan. What we're not going to do is to solve this overnight. However, realistically, we have some really long waits and some real challenges, and I think we've really got to be clear about how we engage the public in helping us with the solutions for those problems.
The Health Board is encouraging everyone to give their feedback so they can address the immediate issues and long-term strategy. Isla Todd, ITV News.